Hi, so welcome back. This is a short summary video of the video I did yesterday. The idea being just to make things a little bit more easy to follow with regard to how to use ice and heat if you are having an injury at this moment in time. Right, okay, so should ice still be used? In my opinion, there is still a place for it, but you have to be careful if you have diabetes or poor skin conditions, particularly circulatory problems, any signs of infection, broken skin, and also if you've had any sort of big injury like a tendon rupture or fracture. Unless you've been advised by another medical professional, I would certainly avoid using ice initially. So when to use ice, and again, this is my view. Normally, it's best to be used with acute traumatic injuries, so tears, sprains, strains, where there's been some sort of movement at the onset of the injury. So if you've lifted something, or you've sneezed, or you've gone over on your ankle, there's some sort of definite onset to the injury. I would also use it just for the first couple of days after the injury onset, and you're really just using it as a tool for pain relief. So it gives you pain relief for about 30 minutes after you're being used. Okay. If it's been beneficial in the past for similar sorts of injury, then again, ice is probably the best option for you to turn to. How to use the ice? So gel packs, ice cubes, frozen peas, just make sure you've got a thin barrier between you and the ice so you don't get any ice burns. So like a t-shirt or some tea towel or something along those lines. Do it for a maximum of 10 minutes at a time and give yourself an hour after each icing to allow the tissues to recover. And you can do this sort of 4 to 5 times a day, sometimes a little bit more if necessary, and certainly not using it longer than 2 days after the initial injury. Otherwise, it has more long-term negative healing effects. So when to use heat? Heat, you have to avoid using heat on tissues that are particularly red or hot, sensitive to touch. Avoid on particularly broken skin, or if there's any signs of infection, any signs of bruising. And also I would avoid using heat in the first 48 hours after an acute injury. Okay, so when you first start trying to use the heat, I would suggest maybe using it just for 10 minutes, assess the effect, see how it feels. If there are no sort of adverse signs, then heat can be applied for a bit longer periods if necessary. And I would suggest something like you can get these kind of wheat bags that you can use in the microwave, or you can use something like a hot water bottle. Okay, so when to use the heat? My opinion, it's better for sort of muscular aches and pains, trigger point pain, postural pains, fatigue, and it's usually better in sort of medium to long-term phases of an acute injury or with chronic conditions. So you can use that heat for sort of 10 to 20 minutes at a time, 4 or 5 times a day if necessary, but just be very wary of any sort of signs of increased swelling or pain. So contrast bathing we talked about before as well. This is the alternating of ice and heat. Okay, so I would do 5 2-minute spells alternating between the ice and the heat, starting with the ice, heat, ice, heat, ice. And you may well find that beneficial for sort of more sluggish healing conditions. So we also talked about the RICE protocol. Okay, so certainly, I would be a little bit careful with the icing of the tissues, particularly after a couple of days. Compression also can be a little bit suspect as to sort of how beneficial that is. Elevation is certainly beneficial. Relative rest, but I think the big thing really is to try and get some movement through it if you can. So if you say gone over on your ankle, and there's an ankle injury, so maybe torn some ligaments, something like that, then just trying to move the foot gently on, regularly over, sort of a few times every hour, just bending the knee a little bit, maybe flexing the hip, just trying to get the sort of the whole limb moving. And now, obviously, that has to be within sort of pain-free limits, and as long as there's not been some sort of catastrophic injury, then I think that can be really beneficial to support your lymphatic drainage system. Okay, so I think that's about it. If you have any questions or you're worried about a particular injury, please get in touch, and I'll try and get back to you as soon as I can. Anyway, stay safe and be well, and we'll catch up soon. Take care. Bye-bye.